Welcome to Catalyst for Healing. I'm Maria Lloyd, licensed therapist, and I'm here with Dr. Richter from Renew Ketamine Clinic. And we are going to discuss today what integration is, because we talk a lot about integration here and there, but we thought we'd dedicate an episode to really describing what it is so that when you're looking for ketamine treatment and getting some good integration, you'll understand better the importance of it and how to get the right fit in terms of getting the right integration. So Dr. Richter, I'm going to start with, because he's done special training in this area, and he at his clinic is with the client throughout the treatment process and provides integration afterwards. And so why don't you share a little bit about what that experience has been like for you, or what do you think? Maybe describe integration first.
So I would say, well, nice to meet everyone, and welcome. Thank you for having me, Maria. I would say the integration is very specific also to the experience. So that's one thing that I would say may be different, especially with ketamine-assisted psychotherapy. Really, the focus is on the individual journey. And so with that in mind, I would say oftentimes it's not as templated as a lot of therapeutic modalities can be with different types of therapies. So what I would say is we can just take an example of clients that I've had. A lot of the times the integration is particular to the experience that a client had during a particular session. Mm-hmm. Usually what I see with clients in the beginning, what I try to focus on, especially if they have never had this treatment or anything similar, and if they're starting their first infusion, oftentimes clients may come with a lot of anxiety, focusing on, and we'll cover that in another topic, focusing on the whole intent, but focusing on more just them feeling supported during the journey and the experience at first. I feel like that's one of the most important things. Yeah. In the environment that they're in the clinic, with me as the provider there, with my nursing staff, I think being able to have them allow themselves to have their own individual experience while feeling safe and supported is really kind of it really paves the way for the journey experience and therefore for the integration afterwards.
I agree 100%. We call it holding space in our field, but that safety and security is so essential for someone entering into this vulnerable space. And so that's why it helps so much to have someone with you that you feel really safe with.
Definitely. And you hear that from clients, the different settings and all of that. We'll talk about that. But the differences that experience can be, the medication may be the same. And you just approach it in a different way, in a different space with a different provider. It can be a whole completely different experience for the client, regardless of that the medication that's being actually administered is the same. So with that in mind, I would say we already try to pave the way for the client to have their own experience. That's my main prerogative, especially in the beginning, is for my clients to feel really that everything has been paved so they can allow themselves to focus on themselves. Mm-hmm. As selfish as it sounds, that's the whole point of the journey. It's your own journey. Mm-hmm. I don't want to indoctrinate you with trying to have you focus on something particular, especially in the beginning. I want you to just being able to experience it on your own, feeling supported and feeling like the risks have been minimized so you can focus on yourself. Yeah. And so then the integration kind of comes out of the journey experience. Mm-hmm. And the one thing that I've definitely seen and that I focus on, especially in the first couple of sessions oftentimes, and it may differ because it is so individual. Yeah. And when I sit there and I try to interact with the client that just came out of the ketamine therapeutic or the therapy and the infusion, the best way to describe the experience oftentimes is I have no words to describe the experience. That's usually the best way to describe it. We can tackle that at a time. But that's where I actually usually focus on the client being able to focus on what the journey felt like. Mm-hmm. And that's the first thing that I really try to, if at all, guide the integration afterwards. At first, I try to focus on the inherent feeling, emotionally, how they actually felt about the experience. Yeah. Almost irrelevant of what happened, what might they have, and may be very ambiguous, may be very abstract, what might they have witnessed, what whether it was visually, we have a playlist we've designed to kind of guide our client through the experience as well in the space. It may be the underlying music, imagery, or not at all. It may just be a memory. It might be an abstract shape linked to an emotion. What I usually try to do in the beginning and the first, oftentimes, couple of infusions is afterwards focusing on the inherent underlying feeling of the experience, of the journey. And
how many people are able to tap into that?
Yeah, that's a good question.
Well, because we get such a range of people like seeing all sorts of things to people not experiencing anything.
Yes.
Like they can't, but they did have a feeling of like joy or, like that they can say, but I don't know. What do you
think that's where I feel like, and we're still, in a way, we're still in baby steps understanding of how this entire process of the ketamine-assisted psychotherapy and the psychedelic state, how it affects what we experience, how we take it forward.
Yeah.
So I would say most of the time, I try to emphasize with focusing on the feeling of the patient, focusing on something in training that we've discussed called inner healing intelligence. The concept of that being that in general, as humans, we understand, even though we don't know oftentimes how to verbalize it or how to necessarily turn it into action or habits or a way of thinking. In general, the human mind wants to be healed and function constructively in general.
Yeah.
It's lending it's lending the individual a certain amount of freedom in a way, and giving them the benefit of the doubt, giving your own mind the benefit of the doubt that it in general knows what it wants to do in order to heal, right?
Yeah.
Oftentimes what happens is a lot of our core defenses and barriers that we build are actually in the cognitive state or trigger response from an emotion. In general, those are defense mechanisms that allow us to function and survive whatever might have happened, including trauma. But in general, we've discussed in training that there is an underlying tone that the client may still have, and I would believe that everyone has that to some extent, this concept that they in general know how they want to feel.
Right.
But it's very difficult to attain in a normal state of consciousness, right? Especially with all the experiences you have, all the defense mechanisms we've built, the habits we've developed. It's very difficult to actually to not only realize that, but to be able to feel that.
Yeah.
And the best example of that, every time, I talk to clients and just the idea of, how can I explain this, me understanding how I want to be? I'm like, well, the best way to, explain it is with a concept that's been around for as long as human has been around is love, right? You can write it. You can tell yourself, love yourself. You can tell about yourself, love other people. You can conceptualize, you can mentalize it. But until you have a certain amount of inherent feeling behind it, I think all of us can to some extent agree, it's very difficult to understand it without being able to feel it. And that's what I usually focus on in the beginning, and the integration is on the inherent feeling. Okay. Oftentimes what I try to evoke is just a familiarity with the process, is focusing on, a lot of the times there are positive feelings that come out of the experience, regardless of what might have transpired during the experience. Oftentimes, even if there was an anxiety, there oftentimes is an inherent feeling is, I am okay. I am feeling okay and safe enough. And that has to do what we do with the preparation and the setting and the set, and we'll talk about it separately. But in general, it tends to provoke an underlying tone and a feeling is, I am okay, regardless of what the witness, what we've witnessed during the journey. And that's what I try to promote in the beginning, is that deep-seated feeling that regardless of what my journey was, and we can talk about specific examples, is inherent understanding and feeling is, I am okay. This is the way I want to feel. Feeling okay with whatever the experience.
Well, and now that you're saying that, just from my personal experience, the taking in that feeling that I had with the medicine of I am loved, I am okay, it was really the most profound part of it, because it strips away, again, when you're in a survival mode and trying to just survive day by day, you're not able to access those feelings.
Yeah.
And so that is probably the most profound feeling that most of my clients come out with, like a sudden sense of like, I'm okay, I can heal, and I am loved. And that, to not have felt that before is so powerful.
Right. And that's what I try to focus on, especially in the beginning, before we start maybe delving into something very particular with the client. And that, perfect, and I've had, countless examples, but some of the common themes that I've observed over the time is oftentimes if there is imagery that comes up, it might be also a memory. Definitely clients will dab into things they have been struggling with or they feel strongly about.
Yeah.
One great example is the idea of family. And I've had so many examples of clients, especially within the first session, they either can't really discern that it was anything particular, but sometimes there is that idea as, I felt like I was, in my old house when I was growing up, or in my grandparents' house, or something along those lines.
Yeah.
Those places inherently, if we delve into it and a little bit more cognitively when we review what might be the triggers for clients, they might be even tied to negative emotions or negative memories, even trauma. But what I try to focus on is, regardless of that experience, that kind of the intense feeling of the upbringing, the formation of our character, is that the inherent feeling was that you are feeling safe and positive about going through that environment, whatever the experience is where.
Yeah.
And that in itself, I would say, anybody who's gone through the therapy is healing in itself. Being, and that goes with the whole idea of maybe some level of dissociation and being able to actually observe and witness from a different narrative than what we normally experience. But I would say that promoting that
third-party perspective is very powerful too.
Exactly.
Because you're just being able to watch parts of your life, whereas before you're immersed in the feelings around it, and you can't work through it in the same way.
And that's what in the integration, especially in the beginning, I try to focus on. There might be memories. Sometimes we refer them to integration. Was there any kind of place that you didn't feel like entering or experiencing? Because you do have control over the experience to some extent.
Yeah.
Even if that's part of the journey, is also succumbing to whatever journey is happening, being able to experience it all. You do have certain level of control, and clients will say, I didn't really feel comfortable going into that space or experiencing maybe that. And that's something that, again, we try to focus on I try to focus on in the iteration in the beginning is, but overall, you were feeling okay, even with that a level of intensity or whatever you weren't comfortable. Maybe we can explore it next time. Right. So that's at first what I focus on in the integration is the inherent feeling that you are safe and then you're okay with the journey that's transpired that might have been tied to many things.
Yeah.
And especially when it comes to, family, childhood, things like that, just being able to nurture that environment, especially in the integration afterwards, focusing on the emotion is kind of paving a way to feel as though you can process things.
Yeah.
I feel like without that, it's very difficult to process. Yeah. So that's what I would say in the beginning. We focus on. I feel like a lot of times.
Do you have any examples of just any situations you can think of?
Yes. I mean, I have an example of a client that was going through, as I understood it, a lot of recent trauma, personal loss, and in the family, and a long-standing depressive symptoms. And in the first session came out and a lot of just trying to focus on the client's family while, loss in the family and in relationships that have not been very nurturing, trying to hold that cell together. Even in the first session, when we were in the integration afterwards, just allowing the client to, oftentimes I also let them verbalize when they feel ready. A lot of times I try not to tease out too aggressively because it can also obscure the experience altogether. immediately what started coming out is, I felt like I was in my grandma's place. My grandma was there, I feel like her presence, right? And I'm like, all right, let's go along with that. How did you feel about, her presence, her experience? And I feel very fondly, about her. Like, I feel like she was always that kind of a persona that was caring for the family, cared for me, more so than my own family, to some extent, my own parents, and always provided like that nurturing environment. It was just a symbol, right?
Yeah.
Brought in from her past or from the client's past. But bottom line is we were able to tack on, well, that feeling that she was providing with an example of a symbol like that. Yeah. And we started to integrate it into her own wishes. Like, who do you view yourself as to be, right? Are you at all? That. And she's like, that's how I feel, who I want to be. I so yearn for that feeling, my own perception of self. Yeah. And in those states where you're removed from your own narrative, basically, from your own, as if we say, the ego dissolution, where you're absorbed from your own perception of self, you can start rewriting the narrative of, you know what, I do feel like I want to, and I like to provide that environment. I want to. You can start building on that. Yeah. That was just the first session. What came out was already what the client wanted to inherently focus on, was self-perception of her own identity in the family.
And that that's huge, because there's actually a theory, narrative therapy. And so being able to rewrite your story in just a slightly different angle can open up a whole different world for you, right?
100%. Yeah. And I feel like what the ketamine assisted psychotherapy and the psychedelic assisted psychotherapy in general, being able to evoke that state of mind, you can, and that's what I was driving at. Oftentimes we like to say, I have a clear protocol, clear algorithm. I'm by training also an emergency medicine physician. So that is as protocolized as you can have it, right? Yeah. That type of medicine. So we like to have, 1 + 2 = 3. If this happens, we move on to this protocol. Right. It's very clear cut. Well, within, we're realizing that might not be enough to heal the mind from our current understanding of how we operate. Yeah. And so we're understanding more and more that without that inherent feeling, it's very difficult to process and to heal without it, right? And that's something in general tends to be a little bit more ambiguous. We would like to be able to verbalize it perfectly, but oftentimes you can't, right? That's why you are experiencing and going through the journey experience. That's what I try to focus on, because in general, what the clients are able to oftentimes start verbalizing when they have the feeling is what they actually would desire. Mm-hmm. And that's something I feel like it's very difficult if you just try to cognitively attack the problem. And that's unique with being able to start rewriting the emotional subtext and then build on that, your own narrative of self. And that example is just one of the examples, but I always feel like it's a great example of your own perception of self within your family, something you might have really been at the core of what you're trying to accomplish, regardless of your past experiences. Yeah. And having that emotional attachment to how you want and how you feel about it, you can really constructively build on that. Yeah. So I feel like that's what I try to focus on in the integration, is the inherent emotional being and feeling, and then emotional understanding, and then we build on that. Yeah. Sometimes we get concrete examples, like with that client, which is fantastic. Sometimes you don't, and that's good enough. Yeah. You don't need a particular memory or an experience to start building on an emotional well-being and processing.
Well, because even Justin and I have talked about how it's sometimes just that little spark of feeling that deep love. Again, it's, if you haven't felt it because you're so immersed in depression or anxiety or struggle, like just that alone can be such a turning point for people, because they realize, oh, I want that feeling more. How can I change my life in whatever way to continue to get those feelings? And they start to build other practices in, and then, their life can take a totally different turn.
And the other thing is, I would say a lot of times also what we see is, I always also try to, in the integration, kind of remind the patient that oftentimes you can be allowed to feel differently with different substances. I mean, sleuth of medications, antidepressants, and all of that. But what really I feel like takes hold oftentimes is what you feel like came from within. And that's something that I would say, and just a full disclosure, I've went through the therapy myself.
Okay.
And it's one of the things that it's very difficult to really fully empathize. And that I was definitely during the training, I was also
encouraged.
You
have to go through it during the training.
You technically don't have to if you can't because of and people train in different parts of the world. We had
it's encouraged.
Actually it's encouraged if you can, so you can have a little bit of a personal understanding of it. It doesn't mean that you can't objectively understand what's happening with other people, but and I was able to at least also personally understand it on my own level, which is that feeling like it's coming from within. I tried to focus on also with the clients in the integration, especially early on. I am not necessarily introducing some kind of happy pill, something that will immediately change your mood, and this is how it's going to be.
Right.
It oftentimes, from what I see in that psychedelic state, in that environment that we create, in the integration, I focus on nurturing that inherent feeling that you're almost feeling like you're creating yourself. The feeling of safety, the feeling of these are the things, these are the values or feelings or emotions I want to feel and pursue. And you start building on that narrative, what you can then do to actually accomplish that.
Yeah.
I try to focus on that feeling that I am not necessarily introducing something new. It's really coming from within. It's just being unmasked in a way by going through the process of ego dissolution and the fact that you can observe it without all of the core defense mechanisms and everything that we talk about.
Yes.
That obscures it in a way from yourself. So that's another powerful item that I try to focus on in integration, is these feelings that are coming from within. They're oftentimes very deeply seated because you do feel like you're creating them almost de novo, right?
Yeah.
Like you're really allowing yourself to feel this way. You're creating it, you're nurturing it. You are able to build upon that. It's not a new element that's being introduced to you. That's another thing that I try to focus on integration. I'm not necessarily introducing anything new. I'm just allowing you to look at yourself from a different perspective. Perhaps with that whole inner healing intelligent perspective, you might find more of what you want, of who you want to be, how you want to feel.
Right.
So that's another aspect that I also try to emphasize in the integration with clients.
Yeah.
Instead of introducing new things and masking things or overriding things from my perspective, it's from your perspective, from the client's perspective.
Yeah. One of the privileges I have is working with clients and then introducing the medicine at a certain point. And so I already have their whole history and really a big understanding of what the traumas are that they're dealing with. So it actually adds a whole different, and I've talked about the different modalities, but I do also use the sublingual form in my office when it's more mild to moderate symptoms. So one of the things that I have found the most, I'd say, life-changing for them is we can go, I don't know if you remember Robin Williams and what was the Matt Damon and him?
Oh, Good Will Hunting. Oh, yeah.
Where there's like it's one of my favorite movies. There's this really cute scene where he's like over and over saying it's not your fault. And he's like sobbing and holding him. And you really feel that, like, having that opportunity to have someone hold him and let him grieve while he's saying that over and over, like, probably penetrated him at a deep level. And I can tell you without a doubt that the majority of my clients, no matter how many times we can say it's not your fault, it's not your fault, they feel like it's their fault. Like they can't get out of that feeling.
Right.
And when they have gone through the ketamine treatment with me and I've experienced, so I will, ask them if they want to talk throughout the journey. And they'll say some things that they're seeing. And then afterwards we'll process right after. But they actually have that experience of like, this really isn't my fault.
Right.
And again, it's just a feeling, but they can carry that and it almost feels like they're released from that struggle. It's really amazing.
My feelings are powerful.
Yeah.
We always try to dismiss them as we're only cognitive creatures,
No.
that behave in that way. I mean, come on,
I know.
We are emotional beings, and the underlying emotion, we don't even understand how important it is, right? But how much it drives our deciation making, right?
But the amount of healing that can come from that, it's like all of a sudden walking away, just like Matt Damon probably felt, of like, it's really not my fault, and they saw it, and they see it from their adult self and not from their child self, which they're enmeshed with a lot of the times. Mm-hmm. And so then they're able to just clearly say, I'm not going to live with that story anymore because it was never my fault.
Yeah, exactly.
Right?
Yeah, no, I agree with that completely. And that's oftentimes what I see as well.
Yeah.
And, there's another term that we use where we as therapists oftentimes utilizing the fact that there is some inherent level of this healing intelligence within all of us, right? Mm-hmm. We're just trying to, that's why it's also oftentimes more called during and maybe immediately after is more of a guided therapy. You're not just saying you have to do this and you'll get this result, right? There are other therapeutic modalities for that. We're just trying to also guide you with something also we describe the whole idea of noble witnessing and noble listening.
Yeah.
To allow you to actually utilize this inner healing intelligence.
Well, you're holding space for yourself. Just what we're talking about
exactly
is how you can hold space for yourself.
Yep.
And that little person inside of you that actually experienced the trauma and hold space for them to heal.
I think that's also really difficult to do any other
cognitively
way. Yeah, it's very difficult.
I know. I mean there's modalities. I think the EMDR, brain spotting, somatic work, parts work. I think there's a lot of ways in those modalities to get there.
I agree.
But for someone who's really immersed in symptoms of anxiety and depression, one of the things I'm realizing too is some of the medications can basically cause you to be further away from the feelings. So they're in a somewhat dissociated state. And so it's very difficult for them to access what really is the source or how to, that keeps them from the full healing.
Exactly. No, I would agree with that. It's allowing yourself the feeling being yours.
Yes.
Within that journey, the experience, that's what we try to guide the client through, right? Yeah. And that's another thing is when they really feel like they have that empathetic listening, witnessing that we tend to provide, it's easier for them to do it for themselves.
Yes.
So that's where you allowing them to go through the experience in such a way, it starts to spark oftentimes the feeling that you can allow yourself to do that for yourself.
Well, and that's part of the importance of therapy with this whole process is a lot of people don't have strong attachments in their life. Mm-hmm. And so if they're not experiencing people that are holding space for them well or allowing for their feelings, they don't know how to do it for themselves.
Exactly.
And part of the therapy is repairing that because they're experiencing it live. Oh, somebody cares about what I'm feeling.
Because that can create literally the whole framework for you to be able to build these habits and cognitive routines, right?
Yeah.
To be able to do that for yourself.
Yeah.
I mean, that's what ideally healing would be, right? No one doing it for you, doing it for yourself in a way, right?
But they have to have that secure attachment in 100%. Order to be able to do that for themselves.
I don't think it's even possible without that, honestly.
I know.
I don't know. I'm sure, obviously, that's possible, exceptions to the rule. But in general, I feel like it's more likely that it won't happen.
Yeah.
If you're unable to actually feel and hold that space for yourself. If you don't even actually understand what that is. And that's what you oftentimes are allowed to feel and understand during the therapy. Yeah. And immediately in the integration afterwards, what that even feels like.
Yeah. So the only thing I'll add, because we can wrap up, but I agree with you 100%, in terms of all the things that you shared and focusing on the feelings, but I actually do like the details because...
Don't get me wrong.
Okay.
I oftentimes go there. I was more just to kind of describe what we focus on, especially when I just want a client at first.
Yeah.
Oftentimes I do sequential treatments and then we can start delving into the details. But yes,
because I feel like it is like having dreams, and you wake up and write them down, and they sound so weird and trippy at first, but then you're like, whoa, it's bringing up your subconscious.
Definitely.
Right?
Yeah.
And so it's a very similar process. Is people can talk about something that sounds super random and weird, but we'll get to what it's really about, and it can be an opener of some other space that needed to be healed.
For sure. And 100% agree. That's why the concrete example I gave was something actually specific in the client's mind that even came out right from the beginning.
Yeah.
I try not to provoke it right away oftentimes, but it's very individual.
Yeah.
There might be very particular things or not particular things at all that might come up, and we will definitely talk about them, and we'll try to hone in on that. I would 100% agree. Yeah. And oftentimes they do. But it's okay. What I'm trying to say, I guess, it's okay if nothing particular comes up.
Yeah.
You can still very much integrate the journey. And that's the important part, where, like I said, we live in a cognitive world where if you don't have a particular, like clients ask me all the time, am I doing okay? I'm like, are you doing okay? I mean, you're alive, all right? You're doing okay here, right? I can't guarantee, or I don't want to tell you what kind of experience you should have, all right? That's kind of besides the point, right?
Yeah.
The fact that you're allowed to go through the journey, allow yourself to guide yourself during, and then we'll integrate afterwards, right?
Yeah.
Even if it's not anything concrete in the beginning, that's fine, right?
Yeah.
That emotional healing, getting the medication also into your system so you can open that neuroplastic window, that's all part of the therapy, right? So 100%. When it comes to details, I love delving into
Let's start with the feelings. Start with
I oftentimes just focus on that, and oftentimes that paves the way to open a can of worms. Everything that might have come up during. 100%.
Yeah.
I agree with you. For sure.
Okay, well, I think we covered it. What we want to encourage people to do is to do the integration work, because whether they have that at the clinic or whether you're getting Spravato, use a therapist after your treatments to try to integrate whatever those feelings are that came up. I mean, you're unique in that you have the training and you're doing it with clients, but very few people are trained at clinics to do this.
Right.
But anyway, that's just our encouragement to you. And hopefully we helped you understand a little more what integration is. And we will see you next week on Catalyst for Healing.
Thank you so much.
Bye.
Bye. Oh, it was good.